Hi there. Welcome to the program Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the Senior Head of Internal Medicine and Cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic, and today I'm starting off without wearing my mask because I want to show you the right way to wear your mask. Remember, if you have any questions or comments, feel free to send us a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. So to put on the mask, I will take it up by the straps of the ears and I will put it completely to cover my nose and mouth. This is the correct way to wear your mask. And when it's time to take it off, I will take mine off now because I'm alone in studio as we're recording this. Again, you use the straps, take it off and put it down. Now, we have seen in the last couple of weeks the introduction of our vaccination program in Guyana. We continue to have COVID-19 positive cases being diagnosed on a daily basis in Guyana. And around the Caribbean, we're also seeing a spike in some places. Unfortunately, some healthcare systems are being overrun right in our own region. And we want to encourage our colleagues and our brothers and sisters around the Caribbean to continue to maintain vigilance and continue to observe all the recommended measures to prevent the spread of COVID-19. And we want to wish them well in their fight against the COVID-19 pandemic. So the big thing that is going on right now in the fight against COVID-19 is the vaccination program. In Guyana, we are fortunate, and some of our other CARICOM and Caribbean counterparts are also fortunate to benefit from an initiative spearheaded by Barbados to allow us to have a small amount of vaccines for our healthcare workers. It is not the full number that is required, but at least it's better than nothing. And we are very grateful to benefit from that initiative. So in Guyana, our main vaccines that we will likely to have are the Astrazeneca Vaccine, the Sputnik V, which is from Russia, and the Sinovac or Sinopharm vaccine from China. This is the reality for us in Guyana. That is what we will likely be getting. We will not likely in the near future get large amounts of the Pfizer vaccine nor the Moderna vaccine, and maybe not the Johnson & Johnson vaccine, which was just now releasing its results. Very encouraging, all of these vaccines. And the best vaccine to take is the one that you have access to. All of them have similar safety profile, all of them have similar efficacy or effectiveness, and so the best one to take is the one that you have access to. In our case, our first vaccine that we have access to is the AstraZeneca vaccine. And the big question that people are asking themselves or asking of their friends and family is, will you take the vaccine? And this question is burning in a lot of people's minds. And if you were to think about vaccines in general, the role for vaccines is to build up your immunity so that when you are exposed to the real infection, you already have some defense mechanism, some immunity to fight off the real infection. It's the same principle being used in COVID-19 that was used in other vaccination programs. The COVID-19 era has seen advances in medical technology that allows us to reach the development of vaccine and implementation of vaccination programs much quicker than what we are accustomed to traditionally. And that in itself, the speed of development, has caused some hesitancy and some distrust and some anxiety in the vaccination program. But hopefully, as we continue this discussion, as we continue to use it in patients, and we have more and more scientific data available people will develop more trust, less anxiety, and more confidence in using these vaccines for themselves and their families. The one that we would most likely focus on a lot is the Astrazeneca vaccine, and this was developed at Oxford University in the UK. Now, as a former colony of Britain and a member of the Commonwealth, we have a lot of familiarity and we have a lot of trust in the name Oxford University. And for a reason, because throughout history and throughout our experience, it has been associated with academic excellence and, positive research in the field of medicine and other areas. Way back in the Ebola virus outbreak, we realized in the world that we did not respond as quickly as we should have. And there were various reasons for that. But we learned a lot from that experience. And some lucky breaks as well as hard work went into creating a template that would be used for vaccine production and other medical breakthroughs when the next big thing comes along. The next big thing did come along, and it's the COVID-19 pandemic. So way back in the Ebola outbreak, researchers from the Jenner Institute at University of Oxford isolated a compound they call ChAdOx1. The CH stands for chimpanzee, AD stands for adenovirus, Ox is Oxford, and 1 is the number 1. So they took a virus from a chimpanzee that caused a flu-like symptom or syndrome and genetically engineered and modified that and made it really into like a vehicle. And that vehicle can then transport any type of vaccine or antigens into the human body and allow you to produce your own defenses. So when COVID-19 came along, what they did, they just added on the spike protein to that ChAdOx1 and injected it into the human body. That is the substrate for the vaccine, or the vehicle through which the spike protein is introduced into humans, and therefore we are now able to see that and develop antibodies against the spike proteins. And the spike proteins, if you remember from our earlier conversations, that is what is needed for the coronavirus to attach to the human body and enter into your cells and cause damage. So we are able to use that technology now to fight off many diseases. And when the next big one comes along again, we are likely to be able to use the same ChAdOx1 technology to fight off these types of infection. So it might seem that this is a rapid development, but the substrate was being developed for almost half a decade before today. And so it's no surprise that they were able to get to the point where we are today. To get vaccines into people and for it to actually be recommended for use, there are several phases of scientific scrutiny that has to be perfected and has to be accomplished before we say, yes, it's safe to be used in humans. We have phase 1 where it's evaluated for safety, phase 2 where it's checked for effectiveness, phase 3 where you look for more major side effects, and phase 4, after you start using it in people, then you start looking for more widespread population-based type of side effects. So there are several long, extensive processes that have to be accomplished before we say a vaccine is suitable and appropriate for use in humans. And all of these phases were satisfied before we were able to get these vaccines to be used for COVID-19 pandemic. The Oxford vaccine from Astrazeneca, for example, is a viral vector vaccine that we need 2 doses to give to people. It is about 60 to 90% effective in preventing serious COVID infection. And this higher number comes after the second dose. It is stored in a regular fridge, and the cost is about $4 per dose. The Sputnik 5 from Russia is a viral vector vaccine as well. You need 2 doses. The effectiveness is about 92%, and this is also stored in a regular refrigerator. It is not the extensive cold storage that is needed for vaccines like the Pfizer vaccine. I believe that is a -70 that is required, and so therefore it will take a lot more infrastructure and investment to be able to use that appropriately, especially in a country with widely dispersed population like ours, where people are not just on the coast, but there are a number of persons living in remote villages, etc. So if you look at the number of vaccines that are available and the number of persons who would have had to be tested before these vaccines are approved for general consumption, the newest one on the block is the Johnson & Johnson vaccine, which is a single-dose vaccine, and perhaps we will get that in Guyana, but it has not yet received emergency use authorization from the FDA. But that has been tested in about 60,000 persons. That's 60,000. That's a large number of people. The Astrazeneca vaccine has been tested in about 50,000 people. Again, the Sputnik 5 in just over 40,000 persons, and the Sinovac in about 27,000 people. So these are a large number of persons who would have been tested by giving them this vaccine before it was approved for the general public. So, you know, normally when we do medical research, a large number of recommendations come out of trials that use smaller numbers like 5,000, 10,000 persons. But because of the global implications and the pandemic nature of COVID-19, we used a larger number of persons to be able to collect more data to ascertain safety. And so there's a large number of persons that received these vaccines before they were approved for general use. As of a couple of weeks ago, there were at least 90 million people around the world who would have received the COVID-19 vaccine. And we still have not really seen any major early side effects from these vaccines. What we have seen in countries that have done significant vaccination programs, there has been a significant, dramatic decrease in the number of ICU admissions and number of hospital admissions for persons who would have received the vaccines. In fact, the Astrazeneca vaccine has resulted in a 94% decrease in hospital admissions for COVID-19 severe illness, versus the Moderna and Pfizer, there is also about 85% reduction. So regardless of which vaccine was used, it has resulted in significant decrease in the number of persons admitted to hospital for severe COVID-19 infection. The side effects that we look out for are the same side effects generally for any vaccine injections or in any injectable vaccine. These include pain at the site of injection. I had vaccine recently and there was some lingering pain for about 24 hours relieved with Panadol. Some people develop chills, some fever, some joint pains, muscle aches, fatigue, and headache. That's common across the board for a number of vaccines that are given to people. The most common reason that people would have had for not wanting the vaccine is remarkable, even in the developed world. The number of persons thinking that the vaccine may not be safe enough is almost a quarter of the entire surveyed population. It's about 25%. Some people are concerned about possible side effects, about 1 in 5 persons. Some people still do not believe that COVID is dangerous for their health, and some people reject vaccines on principle. Now, these are things that are understandable, and hopefully as we get more and more into the era of vaccination, when people see the experience of others and they realize that the vaccine is safe, they themselves would have less hesitancy, less anxiety, and less negative perceptions of vaccines, so that they themselves can take the vaccines and become protected against severe COVID-19 infection. So I want to thank you once again for joining me. Remember, if you have any questions, please feel free to send a WhatsApp message to 620-6275, or you may send an email to docandcovid@gmail.com. Thank you once again.